Yeah, so I'm Venk Vardhan, co-founder and CEO of Nanowear. We're a nanotechnology-enabled or healthcare at home digital monitoring platform. Built upon our core invention, which is an advanced material that we call cloth-based nanotechnology. It's the first cloth that's been approved by the FDA for picking up low-grade and low-frequency, but clinical-grade biomarkers off basic skin contact. And so with the high quality of that sensor and the high quantity of the biomarkers it can lead to, it gives us a very unique ability for digital or AI-based diagnostics in the world of healthcare, which is obviously needs have accelerated very big, very vastly with the pandemic a few years ago. I think we're the first to admit that we kind of got a little bit lucky with the pandemic. We were doing all the same things from a technology standpoint, cloth sensors, feeding a robust back-end infrastructure, software as a service model, and then providing hospitals, physicians, and nurses the ability to digitally diagnose conditions while a patient's in a remote or virtual environment. Before the pandemic, that was cool, but nobody really cared, right? And then the kind of pandemic hit, and overnight, routine visits weren't happening, procedures weren't happening, chronic disease patients with sick hearts, who really need to see their cardiologist for the rest of their life, once a month for the rest of their life, we're just not seeing anybody for a year, and it's because we couldn't take personal services home. And so we uniquely have a solution that can kind of replace all those first-line diagnostic tools. So anytime you go in and see your doctor, whether it's for a specialty exam, primary care, routine checkup, what do? They touch your chest with a stethoscope, put a blood pressure cuff on, check maybe your electrocardiographs, your breathing, your lungs, breath per minute, your lung capacity, your hemodynamics, your blood flow. So our thesis was always, if you could combine all of those tools into a single sort of easy-to-use wearable cloth form factor, you're starting to improve not only the services that somebody can deploy digitally, but now you're addressing a lot of these other sad factors that are coming in due to the pandemic, with nursing staff shortages being very real. I think we're losing a generation of nurses that won't come back. And then the overhead of, hospital providers used to seeing 40, 50 patients a day. They're lucky if they're seeing 10 now. And so this addresses healthcare access and really provider workflow productivity. So in that regard, I without sounding like the biased, doe-eyed founder, I just think that the potential for this is immense. Long-winded way in saying that it can go from primary care all the way to chronic and emergency medicine, but then you think about industrial use cases and workplace safety, military use cases, battlefield to medevac, putting sensors in planes and cars to really understand digital pictures and start to assess risk. That's the goal of virtual care and digital diagnostics. How do I understand who's at risk and why they're at risk, when they're not in front of me and I can't physically touch them? I think unconsciously. I think from when I was even when I was a little kid, I was doing entrepreneurial things that I didn't really sort of recognize or maybe associate with. I remember in junior high and high school, I would put, when final exams would come up, I would put these study guides together, which would help me study, but then I would sell them to, people who weren't doing the work and, do these summaries and stuff, and I'd sell them for $5 a pop, and ran some similar businesses like that, which I probably won't get into too much in college because those were not purely academic entrepreneurial businesses. But then on, I have a family, I think, pushed this a lot as well. I have a twin brother who's a filmmaker and just a brilliant writer-director, but we are sort of left brain, right brain split. I'm the math physics guy, and he's the creative idea generator, and so he can come up with the best story and know exactly how to shoot it, but can't run a budget, can't do an equation. And so we started a company together called V Twins Productions, and I was kind of handling the producer end of it. He was really the engine of the company, but would sort of handle a lot of the things that he wasn't able to. So making films, I think, has a lot of similarities to a startup, right? You've got to get an idea in place. You've got to raise capital around it. You've got to convince people that there's something exciting here and that maybe it can have some ROI. There's a lot of risk involved in films. And I think particularly with a healthcare company like us, from sensors all the way to AI, film's very similar in that regard, that there's so many different departments that you have to keep, like the trains sort of moving at the same speed and all end up at the moment of production time when you start shooting, right? Because you lose an hour or you lose a day, you guys know, I mean, that's a lot of money, you know? And so preparation, I think, really meets that. So I was doing that sort of for probably 10 years in New York after college with my brother. And but I think what really hit from a technology entrepreneur standpoint was my sort of professional career before starting Nanowear 7 years ago, which was on the technology finance side. So I had a career in investment banking and then subsequently growth equity. So I got to really meet a lot of these management teams when they were at the Series B or Series C level. And I think until you really start to get to know these people, like you have this unsort of characterized thought of who a founder is, and that they've got to be some really special person, some messianic type person. And then when you get to know them, you just realize this is about vision and hard work. And that's really what I sort of learned in my sort of 8-year finance career. And I was in my early 30s and kind of, you know, I knew I didn't want to be a finance person for the rest of my life. And that's sort of where I think timing kind of just met opportunity. And I'm sure we'll get into a question about how the technology came about, but that's a very cool story about how myself and my co-founder came together and started the company about 7 years ago. So. Yeah, I think it's a phenomenal question, and I am sort of smiling and laughing because my experience is different, but there are going to be some parallels for the other founders out there. So I did not choose to meet my co-founder. I've known my co-founder my co-founder's known me my whole life. He is my father, Dr. Vijay K. Varadhan, and he's a 40-plus year academic professor in biomedical and electrical engineering, and this was one of his last ideas before he retired as a professor. He did a lot of nanotechnology-related work for research projects for the Defense Department and military applications, really understanding how could nanotechnology or nanosensors, which really the key of them is you've got billions of these sensors at a very small footprint of surface area. And because you have so many of those touch points, you're getting more accurate sort of understanding of the environmental factors around you. So Dr. V started his career in sort of building sensors on the hulls of submarines, because below a certain depth, all the sonar signatures from a school of fish to a whale to a geyser to a Russian sub start to look the same. And so you can't make the sonar machine bigger, you can't make the submarine bigger to start filtering out, but if you start lacing the sonar sort of sensors with nanosensors, you can start to direct different sort of understandings of sonar signatures. So long story short, his thesis was the human body is an also hard to detect environment, and with exponentially higher surface area with a nice user form factor, we could really sort of benefit in healthcare. So he's one of those guys that's just been thinking decades in advance, and this wouldn't have even been possible, you know, had we tried this 20 years ago. You need smartphone technology, you need Bluetooth, you needed, you know, 4G and 5G internet. So I think this was a great example of, I think, founders sort of coalescing around a technical vision that we felt was the right time for it. And I think for other founders that are, I've always said that the best blend that Dr. V and I had between each other was a very sound understanding of the technicalities. I'm a biomedical engineer and biochem and chemistry by academic training. And so I understood the math, I understood the calculus, I understood biopotential as a sort of feature. Not as well as Dr. V, but I also had a strong sort of, business, marketing, sales acumen along with finance. So that's really, I think, the best blend for founders to find is a good complement of skills around the technical vision, as well as who can actually operate. Dr. V's the most brilliant man on our team, and there's a reason he was a professor his whole life, right? He's an idea guy. He's not a builder. And part of our challenges in the beginning as founders, and even though we have unconditional love as father and son, there were tense moments there. He wanted to be involved in all the finance and business discussions and wanted to make sure that I was involved in all the technical discussion. You really have to start understanding who's focusing on what, and that this is not an academic project. This is not a research project. This is building a product for sales. And that was something that I think from our technical team, to me, it was really myself and one other of my colleagues that I worked with in finance that were on the business side, Dr. V and 5 of his founding engineers who were his master's and PhD students, and sort of bringing that gel together in the beginning and really kind of retraining both sides' minds that have worked at big companies and then also worked at big academic centers. This is the goal, stay on mission. I know this is important to you, but it's not important to the business. I know this is important to me, but this is not important to the business. And the sooner founders can get that blend together, I think is the first key to success in getting a product-based company off the ground. It's a great question. I think me personally, I'm lucky, I'm fortunate. My father and I aren't going to walk away from each other, which sadly you do see happen with founder pairs for sure. So that's unique for us, as difficult as times might have got, as much as we may have disagreed and fought with each other, that we sort of know that we're always family, right? And to his their own, or to hers their own, as a founder and a hiring manager. But I've kind of taken that approach with other people in the company and executives. A lot of times people have told me, you hire a lot of your friends, you hire a lot of people that you've known for a long time. That's not necessarily a good idea. I've always kind of been the person that disagrees with that. I know their skill set. I've known them for a long time, and I know them personally. I know that when they join, the personal connection between me and them, yes, may be at risk because now we're employees, but I also know we're not going to let each other down because we have that personal connection, that personal vibe. And I think that stemmed from me starting the company with Dr. V. I'd say probably some of the more tense times are when it sort of expands more broadly into the family, right? I'm equally as close with my mother and my father are best friends. And so when something happens at the office, not like my mom doesn't know about it, right? My father goes, they have dinner together every night. And so when I talk to mom, he's like, what happened? What was this fight here? And so I have to explain that, and then my siblings sort of understand it as well. So I'm not a parent with my own children, probably because over the last 7 years it's been time consuming with the company. But the family dynamics and the personal dynamics around a company, irrespective of your relationship with the founder, with your co-founders and your early management team, is always something you have to work on. It's going to constantly evolve, and it doesn't always get better. Sometimes it'll get worse, and you have to really identify and address it. You can't; those are not issues you can sweep under the rug. I think the experience that I had really doesn't go further than just being comfortable asking people for money. Because you've been on that other side of the table before. I personally, I take this back to my days in filmmaking, I think there are very few parallels you can go from company to company and say, this is how it's going to be from a fundraising standpoint. Short of products or technologies being very similar, right? And you see that a lot in technology. You see one company sort of trailblaze and then maybe 5 or 10 Me Too's that are somewhat similar but might have some different aspect. And that can sort of map your fundraising strategy pretty clearly, right? Okay, this fund is invested in this space. Here's a competitive fund that sort of is the same size and same scale. I should go talk to them. That's the first step, is really targeting who's the right investor for what you're doing. I say that with a grain of salt, that if you're doing something really transformational, particularly in healthcare where it takes a long time to get your product out, and ROI is not going to be within 2 or 3 years, it's probably going to be more 7 to 10. Targeting is even more important at that point. And I almost feel like most companies thinking that if you're a first-time founder, getting a giant check from a big-time VC, pretty rare. You have to start with some individuals who know your space, who really believe in you. Everyone's like, oh, friends and family, that means that only rich people can start companies. I don't think that's true. I think that understanding expertise and a alignment in vision is where you have to start with investors. And then you've got to get some capital in the door and prove some sort of milestone that is relevant for the VC next. And then you've got to take, I think, a long look in the mirror and ask yourself what you want out of this. Is your burning desire to be a startup with a unicorn valuation because that's what validates you? If that's the case, you're probably spending 95% of your time thinking about, well, this is what I have to do between, I'm going to raise my seed round now, but this is what I have to do to get to my B round. You're always raising for the next inflection 2 rounds down the road. And I think the most successful founders that really shore up capital well, they're experts at that. And once they do it once, it's very, very comfortable for the investor market to lean on them again as a second-time, third-time founder. When you're a first-time founder, you got to figure that out. And targeting, I think, is really where it starts. But I also think it's the second point I made. You've got to surround yourself with the right advisors and the right sort of individual investors in the beginning if you're a first-time founder. And you have to be comfortable with saying, I don't know. And that's difficult for founders. We're supposed to have all the answers. We're supposed to look really confident in front of investors and know that we have all the same answers. And so honesty, transparency, and being genuine is a skill we always adhere to in the DNA of our company. It's not necessarily the best thing to do when you're fundraising. I think that the inflection between seed and Series B is probably the most prominent as far as differences in financing. When you're in the beginning, your seed and even your A round, it's still a lot more idea. It's still a lot more vision. Really framing the total addressable market. How big can this be? What sort of milestones in either product dev, technology dev, or in our case, regulatory or clinical, have we started to show that we've de-risked? But honing in on a really specific business model and having customers, probably not as important at that stage. But when you're raising a Series B, depending on every market and industry is a little bit different, but in general, they want to see that you've contracted somebody, that you've even got some minimum sales, right? And how does this business model sort of work? What I found with Series B investors, or at least at that stage, for better or for worse, most of the investors are looking for pattern recognition. And so on the business model itself. So if you can point to a company that says, this is how they sold, this was the pricing point that they did, they gave 10,000 units away for free to create an install base, we should follow the same pattern. If you can start to identify those around your business model, even though your sales might be a little bit nascent, that's an approach I would recommend. And again, industries and markets are different, but I think that also can get you into trouble if you are doing something completely groundbreaking. A lot of us in digital health that was coming out of COVID, there was no business model to point to. Didn't exist. We were actually working with, Medicare and Medicaid, or in the UK NHS. You'd have to sit down and talk to these people and be like, all right, this is the situation. How do we figure out a model together on this? Because all of our goals are the same. It's helping patients, right? And so for companies like us, I think it provided a lot of opportunity to help educate the market. But that's not something that typically happens, right? Particularly in a bull market that we've had for almost 10 years straight of VC financing. How long do we have? I mean, I think, and again, time will tell whether we were successful or not. I think we've proven a lot, and I'm really, really excited for the future. But as a founder and a first-time founder, I mean, you're always, I encourage everybody to continue looking themselves in the mirror and be like, what could I have done differently there? I'll go as far as my initial presentations. Speaking cadence, spoke too fast, was speaking too much science, too much physics, too much chemistry, not enough vision, not enough idea. And that's just me as the sort of founder CEO. There are product related decisions that I made that I wish I didn't do. Making a hardware product as a wearable, we started as a tank top for men and a bra for women. I was so romantic with this idea of just underwear and clothing. And the minute I took it to a hospital system and to a payer, they're like, so how many sizes am I going to need for this? I don't know how many 6 foot, 300-pound men are coming in this week. And that was the rake that hit me on the head. Like, oh gosh, I'm going to have a giant inventory management problem. But again, you're never going to know these things until you walk into or you trip over those bricks as a first-time founder. So I think the second part of that is you got to take it as a learning experience and be like, this was valuable. I don't like that sort of mantra from the West Coast, like fail fast, fail often, but there's some truth to it, right? I don't like the word fail. I think learn is and progress and being comfortable saying, I got this wrong, or being comfortable saying, I don't know, I need help. And that's something that I learned in the first couple years that I've really tried to ingrain in our DNA. Do not walk around thinking you know everything, particularly in a complicated space like ours, because we know enough people now that we can get help. There's probably, I'd say, over 100 things I wish I did differently over the last 7 years. Yeah, I think lots of ups and downs. And I think attitude and sort of mental acuity of what you're good at and what you're not good at is sort of ground number one, right? Because that's really what drives the ups and downs. Financing markets, customer deals, milestones will always take longer than you think. There will be people that lose faith in you from either an employee standpoint or an investor standpoint when you don't deliver results that you promise. And a lot of this is, it's us being confidently speculative, but it's still speculative. I remember some of my first pitches I put in my revenue model, like that we'd be at like $100 million in revenue by this time. No, and so I think that understanding up front that it's very rare to continue delivering over and over and over without mistakes, ingrain that in your sort of mental fortitude so it doesn't bring you down too much. And then I think the second thing you have to do as a founder, I know this is difficult, you have to remember what you signed up for. This is a really tough line of work. And until you've done it, you can't relate to it. So if you choose to do it as a first time, I really encourage you to get your support system around. If you have your own family that you're living with, make sure they're on board because you're going to be doing this together. And those ups and downs are going to affect more people than just yourself. And if you're the type of person that complains or woe is me, this is not the right role for you. You really, really have to check that at the door. I remember the first time when and this happens to many, I actually, if I ever write a memoir, I'll be like, the real founder is somebody that didn't know how to fund payroll at least multiple times. Knew they were running out of money and had to figure something out before Friday. Or otherwise he or she would lose his troops. And I remember the first time that happened to me in a year and a half, we were in San Francisco, me and one of my colleagues, and I just broke down crying at the bar. And he kind of let me for about 15 minutes. Such a great friend of mine still today. He just let me have it. He's just like, look, man, you signed up for this. And if you don't figure this out, me and my family are screwed too. You know what I mean? I believed in you to start this, right? And that was the first and only time I needed to hear it, and I've never forgotten that type of advice. And he's technically somebody who reports to me, or reported to me, but that was one of the best things that could have ever happened to me, I think, as a founder. Mm. Cover your groundwork, like up front. You've got to make sure that you're doing something to distract yourself. You've got to exercise. You've got to eat healthy. Particularly if you're a startup founder and you're the CEO, you're traveling a lot, you're asking people for money a lot, you're sleeping in friends' couches, or if you're somewhat well-funded, maybe you can afford a hotel or something like that. But you've got to stay healthy. You've got to keep the physicality of your body healthy, or the mind will subsequently forward. However you do it, you've got to make sure you can somehow catch up on your sleep, because I think the other thing with the founder, it's very hard to slow our brains down at night when it's time to go to bed. We're thinking about too many things. And so, not to get too deep into this, but you guys probably know at the Founders Network, I mean, a lot of us do have some issues with self-medication. You know, let's be honest about that, right? Drinking alcohol does pick up, or cannabis use, or what have you, and you've got to be cognizant of that too, because that can start to become a slippery slope as well. And you know, some others have just other vices as well. They need to go to SoulCycle and just crank out in the morning and at night. Others need to, you know, make sure phone's down for an hour and a half when I play with my kids, because that's what takes my mind away with it. Or your significant other or your spouse, the time you're spending with them. And then I think the second thing that you have to do to really sort of adjudicate that mental toll, remember why you did it, and remember that when you have fun, when you're having fun, celebrate that fun, and make sure that you are reminding yourself the importance of the mission, and that it was also fun for you to do professionally. Because if you lose that last part, the mental sort of toll on this becomes really heavy. Legacy, I think, is important to any founder. Let's be real here. I think, particularly for an inventor, like our co-founder, Dr. Varadhan, I mean, money is the least important thing to him. You know what the most important thing to him would be? Like him receiving the Nobel in Stockholm, right? He could live in a box as long as he had that, you know? So I think there's a little bit of a difference between technical and business-minded founders. But when you go for it, when you start something and you put your blood, sweat, and tears into it, anybody would be lying if they said they didn't want to be remembered for it and those efforts. But our DNA has really been about the collective, right? We don't use I, we don't use me. We say, you know, we, us. And that is something I think we instill when we're interviewing people and we're bringing people on board, that this is a family, this is a mission, and if we do what we're supposed to, we're going to be immortal, all of us, right? And so I think legacy is important for every founder. I think uniquely for us, like, I would love to send my father and my parents off with with that last sort of really amazing chapter, which is a culmination of his life's work to get here. But that's personal for me. But I'm sure every founder has some sort of personal component to that sort of idea of legacy, for sure. Yeah, so you can go to nanowearinc.com. We are only approved in the US to sell at the moment, so we would not be available internationally for some time, but go to nanowearinc.com. We've got a bunch of connections to peer-reviewed journal publications, our FDA approvals, some great media coverage that has covered us, and feel free to reach out to our team. should we be a working or collaborative partner to you, because we're the first to admit that anybody in health tech, as complicated and as moving parts as there are, no one's going to do this on their own. It's going to be a method of collaboration and sharing insights and best practices and really sharing a network. And I think that's true for every founder in every industry, but probably not more so than in healthcare.